Okay. You just told me what was going on in our society right now, public health threat of the coronavirus. I wanted to ask you, can you tell me the name of the governor of the state of California?
Gavin Newsom.
Okay, that is good. So my patient is alert and oriented times four. Um, we'll proceed with obtaining some of your information, which could be personal, but I want to let you know that everything will be kept confidential, and just want to reassure you about that. Can you please tell me where you were born?
I was born in Nigeria.
Okay, so you're
So I'm Nigerian American.
Okay, are you married?
Yes, I'm married and I have 3 kids, 2 girls and a boy.
Okay, what is your job? What kind of job do you do?
I'm a licensed nurse.
Okay,
And right now I'm in the nursing program also to get my RN.
okay, so that's very good. It would be appropriate to hope that after you finish your nursing program, you will come and join a Turo for a master's degree. Is that a good thing to hope for?
Yeah, it seems like a good program.
Okay, all right, okay, that's good. Do you have any? Are you a veteran of the U.S. military forces?
No, I'm not.
Okay. Tell me a little bit about yourself. What are your hobbies? What, especially in the areas of diet, exercise, and all that stuff?
Well, I like to eat African food.
Okay.
Yeah, I'm not a fast food person.
So you prepare your own food?
I make my own food.
Okay, that's good. Yeah. Tell me a little bit about your economic and social status. You say you're a licensed vocational nurse. Now you're going for your RN program.
Yes.
That is very good. So, do you own your own home?
Yes.
Okay.
We have our own home. You know, we're a family of 5, me, my husband, and my 3 kids.
Okay. So, do you have any problem accessing healthcare for you and your family?
It's been, our healthcare has been pretty good because we have insurance through my husband's job. It's been really good, but due to this pandemic, it's really hard to get your healthcare provider to attend to you, because they're attending to people with coronavirus, and that's all they're talking about. Everybody else has to kind of wait for now.
Okay. So, how are you for exercise? What do you do?
I take walks.
Okay.
I haven't really been doing much of that because it's been cold and.
I can understand that.
Yeah.
Okay. How about
dancing?
Okay. All right. As far as water is concerned, how many cups of water do you drink a day?
No, 6 to 8 cups of water.
Okay, that's great. That's great. I can, just looking at you, I know that I can see that you are taking care of yourself. You look clean. You look healthy. You look very presentable. You're feeling well. I can imagine that. How about dealing with the stress? Do you take caffeine, coffee, soda, or energy drinks to help you?
I'm not really a soda person. I might take soda once a month, just like coffee. But I usually, if I like, I had to get some coffee last night because I haven't, for the past 2 days, I haven't been sleeping well.
Okay.
Yeah, but normally I don't take coffee.
Okay, good to know. What do you do for your leisure activities?
Well, I like to listen to music, hang out with my family, do some fun stuff. It might be kids games, whatever they're doing, or watch TV shows together. So anything that'll make us laugh and anything
that is good. Do you have any other alternative health practices that help you keep fit and keep healthy?
Prayer, meditation.
Okay. Okay. So talking about sleep issues, that's what your chief complaint coming into this place. How are you able to deal with the stress of not sleeping, the emotional roller coaster of this coronavirus and all that stuff? You wake up, you turn on the TV and that is what you hear. How are you able to deal with that?
It's it makes you anxious.
Mm-hmm.
It's stressful
Okay.
because you're thinking about work. Now at work they're testing us. If you get to work and you have a temperature of 99.1
Mm-hmm.
or more,
Mm-hmm.
they send you home.
Okay.
So stuff like that. It makes you anxious. You're
Yes.
depressed. You get irritable.
Yes.
Yeah.
Okay. One of the other areas we want to focus is your medical history, your past medical history. Then we can get into your family history. Tell me a little bit about yourself. Do you have any history of head injuries?
No.
Okay. Any member of your family, grandparents, father, mother, brothers, sisters, or your children, anybody have
No head
history?
injuries also.
Okay. Any history for you? Do you have any problem with your eyes, like changes in vision? Does anybody in your family have that?
Well, we don't have problems with our eyes. It's just we need glasses
Okay.
for reading.
Okay. That's
Yeah,
good.
my parents they wear glasses for reading.
Okay.
Me, my kids, my husband.
Okay. So you're able to afford that, right?
Yes.
Okay. Okay. That's good. Do you have any problem with hearing? Like, have there been any changes in hearing for you?
No, listen, no problem with hearing.
Okay. What about any member of your family? Do you have that family history?
No, nobody's ever had problem with hearing.
Do you have any problem with having nose problems, like nose bleeding, not able to breathe through your nose and all that stuff for you or any member of your family?
No.
Do you have any problem with your mouth, your teeth, your throat? Any problem in those areas that will affect your ability to chew, swallow, eat, drink, or anything like that?
No.
And for your family?
No,
Nobody had that problem. Do you have any problem with your thyroid? Things like goiter, anything that will affect your how you feel, hot or cold, anything like that, or any member of your family?
No.
So your parents didn't have any such problem.
No, they never.
Do you have any problem with your neck, your shoulders, your ability to move around your joints and all that stuff? Do you have that problem with you or any member of your family?
No, I don't. But occasionally as a nurse, your legs might hurt after standing for 8 to 16 hours.
Absolutely.
Yeah, so that's what it is.
Okay. Do you have any problem related to cardiovascular disease like hypertension, heart attacks, stroke, anything like that for you or your family?
For me, no, but my parents they had high blood pressure.
Okay, high blood pressure.
Mm-hmm.
Okay. You say you're currently any of your brothers have presented with high blood pressure?
No.
Do you yourself, you don't have that problem at this moment?
No.
Okay, so that's one of the things we want to look into, make sure that
It doesn't happen.
It doesn't
'Cause
happen.
I am pretty stressed out
There
right
you
now.
go. There you go. Do you have any problem with your neurological state of mind, like things like any problems like seizures or forgetfulness for you or your family?
I know. Even
Okay.
even my dad, his brain was intact.
Okay.
Very
All right.
empty.
Do you have any problem with your pulmonary system, your respiratory, how you're breathing, any problem breathing, difficulty breathing, shortness of breath, or snoring, wheezing, and all that kind of thing
No.
for you or your family? Okay. Do you have any problem with your abdomen, your gastrointestinal system, things like constipation, things like diarrhea, any surgeries whatsoever for you or your family?
No. But once in a while, you know, people have constipation. But
Okay.
it's not like an everyday thing. Once in a while.
So do you use laxatives to
No.
do that, to
No.
help with that?
No.
Okay, so because you told me you're drinking 6 to 8 cups of water a day.
Yeah, I
So,
don't need help.
and you do your exercise. That's good to know. That's good to know. Other thing I want to ask you, your genital and urinary systems, do you have any difficulty urinating, any pain on urination, any things like incontinence, hesitancy, frequency for you, your parents or grandparents?
No.
Okay. Do you have any problem with the endocrine system, which will make you have problems like sudden weight gain, depressive moods, things that will affect your mood and all that stuff? Any problems with that?
No.
Do you have any problem with cancer issues for you or your family?
No history of cancer.
No history of cancer.
Thank God.
That's very good. Do you have any problems that could be attributed to hereditary or genetic disorders? That you may have inherited or your parents have inherited that you know about?
No.
Okay. Do you have any history of substance abuse, things like drug, alcohol? Do you smoke?
No.
Okay. And what about your family?
No, nobody smokes.
Nobody. Okay. That is very, very good. Do you have any problems with allergies? Now, when we talk of allergies, I want to know: do you have any problems with allergy to medication? Are there foods that you're allergic to, or the environmental factors like seasonal allergy? Do you have any problem like that?
Well, you know, it's not really.
Okay.
Not really.
Okay.
You know, once in a while you get when I'm not, I'm pretty healthy.
Mhm.
Once in a while I might get a cold. Maybe once in 2 years I might get a cold,
Okay.
and
Okay. Well, that is very, very good. The next thing we're gonna do is we'll get into the hands-on aspect of this activity. I wanna. Do you think you need a moment to stretch out and get something to drink?
okay.
Okay, all right. Thank you very much. So we'll go ahead now and continue with the hands-on aspect of this examination. So, like I said, this activity will include the hands-on, which I'm inspecting your body. I'm going to put hands on you, palpating, percussing, and then auscultate. I will listen with my stethoscope. So that's how we're going to do it. When we get to your abdomen, I will inspect, then I will auscultate first, then I will percuss, then I'll palpate. Okay? All right. So we're going to start with your head. I'm going to stand up. I will be, like I said, I'll warm my hand just to make sure that you're okay with that. I'll be, touching you. Is that okay with you?
Yes.
Okay. So we're going to start with your head.
You need me move a little.
Okay, that's fine. You appreciate that. So starting with your hair, looking at, just looked at it. I don't see any physical changes. No, I don't see any swelling. I don't see any. Looking at your scalp, it's intact. I don't see any open areas. The texture of your hair looks good. I don't see any patches of what we call alopecia, where you're losing hair. Okay, that is very good. And I'm looking at your face. I can see that your face is okay, no problem. I don't see any swelling, no redness or cuts, no open areas. I'm looking at your eyebrows, your eyes. Your eyes are well situated in their socket. Looking at it is symmetrical on both sides. I can see there is no swelling, There's no redness. There is no change